placenta previa. So here you can see that most of the time the baby remains down. Here is the head, baby's head, and you can see neck and then folded foot and everything. This is the baby, and most of the time placenta, it remains here at the fundal area, but when it comes to the downstairs, then this is the, you can say this is the placenta here. Placenta, if it is coming to the lower sides, so most of the blood vessels, they penetrate inside the vessels and they can comes to outside, and they grows to manifold, and they grows to make a tumor sort of things. They grows here, they can grow and make a tumor sort of here. The placenta is highly vascular system, and that's why it is a highly vascular. Many patients I have seen lower placenta previa with lower cesarean section, I saved their lives. And for that, most of it is advisable to give the classical incision. We should just cut over here and remove the baby, and we should not touch the placenta which is at the lower segment, if placenta is lower side. Okay, so we should not touch the placenta. Just cut the upper segment, remove the baby out, and if cord is there with umbilical cord, we just tie the knot with that placenta and leave it as such, because we cannot remove everything with placenta accreta. All this is known as placenta accreta. We cannot remove every vasculature and everything. If we try to remove placenta, then everything torn up and bleeding will occur, and it is not going to stop. And this is the collection of the blood vessels, you can say small tumorous collection. It can be in a broad ligament, it can be in a lower cervical region. One of the patient I saw in my lifetime, she was having huge tumorous growth anteriorly in the bladder, penetrating in the broad ligament and downstairs to the cervical os, and it was like a tumorous growth. And when I opened the abdomen, I saw that everything, I didn't got any line for incision, so I just cut upstairs and removed the baby and left cord. I just tied the cord and sutured it everything, and just made the patient to lie on a bed and wait and watch. I did successfully. I did regular USG, and then I found that everything was normal within 6 months. Even she didn't had heavy bleeding, and she was not had any discharge. So that patient again, she got conceived just now, and at this time also she is having placenta previa, but it is at the higher side. So what I feel that we should just wait and watch. Most of the time when you see through MRI or pap smear, that can show some sort of malignant change. They mimic like malignancy, that they may not be malignant. So just wait and watch, what I advise. Thank you.